I'm Dr. Christy Osborne at Scenic City Clinic, and I want to run all of you guys through today on some stretches that are really going to help open up the hip flexors, the glute area, and help to relieve some low back issues and just get our hips and legs moving better. These are really beneficial for everyone. Everything we're going to do, I'm going to show you guys all on one side and give you guys all some timing for it. Set a timer, use your watch, use something to really make sure you're giving the muscles and the soft tissue the time it needs to settle into these. But what we're going to do is we're going to start out with one leg forward here, and we're going to have that at 90 degrees here, and then we're going to have the other leg out to the side, and we're going to have that also at 90 degrees. What you want to do, just settle in. We don't want to be turned this way, but really settle in kind of in a neutral position, but facing a little bit more forward here. And you just want to relax into this. So just trying to sit up as straight as you possibly can, and then just rest. And what you want to do is you want to hold this for 4 minutes. After those 4 minutes, what you're going to do is we want you to lean forward over this knee as far as you can. And again, just breathe into that and rest into that. You're going to hold that also for 4 minutes. After that, what you want to actively do is push this knee down into the ground. You're going to hold that for 1 minute. After that, you're going to take this knee and actively pull it up, and you're going to hold that for 1 minute. After you do this, what you want to do is rest into a child's pose. That is a term for a yoga position, but what you do with that is you're actually going to put your toes together, spread the knees apart, and you're going to bend forward. Put your arms and your forehead down on the ground. You're going to hold that again. We're going to go back to the 4 minute hold on that. And then after you finish with that, we're going to do some active movement with these hips. And what that is, you're going to put your hands behind you just to support yourself, bend the legs up, and then spread the knees apart. And then from there, what you're going to do is you're going to do internal and external rotation with these hips. And that's going to help to move all of this, really get good internal and external rotation. And you're going to do this again for 4 minutes. So with that, it should be about 10 minutes on each side. So make sure after we do the one side, we flip to the other, bring the other leg forward, the other leg back, run through the seated, bend forward, knee down, knee up. So 10 minutes each side with that. Then we've got our 4 minutes with our child's pose, and then the 4 minute of that active movement with the internal, external rotation. And this should really help open up the hip, open up the hip flexors, and work on the glutes and get more active motion into the hips.